The Mandate Health Empowerment Initiative, in collaboration with the Ministry of Health, held a roundtable delegation for mental health advocacy reforms and call towards building a mentally healthy society, which was held in the Federal Capital Territory on the 31st day of October with the objective of suicide decriminalisation, strengthening national UHC policy and system reform, as well as many others. Ahmed Zion Abba, president and founder of MHEI, spoke on the initiative to this movement, which is created to integrate mental health into universal health coverage, basic health care provision fund, also adopt and operationalize National Mental Health Act 2021 across Nigerian states, as well as suicide decriminalization, data and local study on suicide in Nigeria, urging to join forces with government agencies in order to help mentally unstable patients as well as suicidal patients to care and show love to them rather than shun or jail them.
I want to say categorically that one of the ways that we are hoping to drive our partnership or synergy with the Nigerian government is through the Federal Ministry of Health, through the other ministries and national primary healthcare development agencies. We have been working closely to see how we can improve our partnership with them and see how we can really prioritize mental health engagement. And of course, this is coming in threefold. Understanding that the place of the civil society organization is very critical to achieving any of the government agenda. You can't excuse the place of the civil society organizations in achieving any social or social, economic, or any governmental goal in Nigeria without the presence or without the contributions of the civil society organizations. So one of the things we're doing strongly is to improve the collaboration with the government through the ministries, through the agencies, and through the primary healthcare center, the primary healthcare board, to ensure three things. One, the integration of mental health into the universal health coverage, ensuring that the basic the basic trust fund is something that is clearly and visibly showing the integration and the mainstreaming of mental health into the activities. We want to see clearly where and what exactly is the place of mental health in the universal health coverage and how this is actually reducing the financial hardship on Nigeria. Number two is we want to see how the government and her different arms of governance, whether at the legislative, whether at the judiciary, or even at the executive, how are they helping to adopt and operationalize the National Mental Health Act 2021. This needs to be done, considering how much Nigerians are now becoming vulnerable to mental health conditions and so many other viruses that are upcoming. So we want to see how this act can provide leadership and direction and service to Nigerians and improving their mental well-being. Thirdly, we want to see also how the government can clearly be committed to decriminalizing suicide in Nigeria. Suicide must be decriminalized. Suicide should not be seen as a crime. Suicide should, we must, as a government, as a people, as CSOs, as FBOs, we must shun suicide as a crime. We must see suicide as a mental health condition matter issue that should not be punishable, but some level of care, some level of support, some level of cushioning measures should be provided as against the punishment or jail term or other forms of punishment that are accrued to people from the penal code or from the criminal code. We should be able, as a government, sympathize, empathize with Nigerians who come down with this mental health condition and provide support for them, not punishment. Provide, enabling, a platform where they can, without any fear of stigma and discrimination, enjoy access to care and access to support.
Lois Otta, the founder and chief executive officer of Cedar Seed Foundation, addressed the cost of mental health as she calls on all stakeholders to put in action in building a strategy to kick out mental health issues, and she emphasized on the high cost of living and how government can intervene. She as well advised the Nigerian youth and young adults.
In a day, from a day it will move to an hour, From an hour, it will move to a minute. From a minute to a second. So before it gets to a second, let's do something quickly, collectively. All of us, all the key actors, all the stakeholders, they need to come together and develop a strategy that will kick out mental health issues in this country. And how can we achieve that? We need to implement the 7 objectives in the Mental Health Act. We need to set up a budget line in the Federal Ministry of Finance and National Planning. Doing that will help us to have resources that will curb the issues of mental health. The Nigerian government should reduce the high cost of living in this country. When this is done, people will begin to think well. People will sleep when it is time to sleep. People will eat when it is time to eat. People will go to work when it is time to go to work. Do you know that in some offices now, they go to the office twice a week or 3 times a week because of this fuel issue? So Nigeria should have a rethink of some of these policies they have in place. Is affecting the healthy lifestyle of her citizens. And I want to call on Nigerian government with a loud voice this afternoon and say they should have a rethink about policies that affect the mental health of her citizens. Nigerian citizens need to have some principles that guide their lives. And one of these principles is persistence or patience. Young people should be patient to hold on to God. Only God will give them jobs when it is time. So hold on, you don't need to rush. Young people need to have integrity. When they say stop, stop it. When they say do, do it. When they say don't take drugs, don't take drugs. Drugs is affecting your mental health. You think drugs will subside your thinking capacity about having a job? No, it's a lie. It's a big lie from the pit of hell. So I need young people to start thinking of being creative, being innovative. They should come up with ideas that will make them problem solvers.
Olushola Ephraim Oluwanuga, head of Department of Psychiatry in the University of Abuja, sends a message to Nigerians at large, schooling them. Mental health isn't just about the mentally unstable man on the streets. It also comprises of emotions, feelings, understanding to things, and ability to relate with others, and lots more. It isn't just the absence of disease. She stated the things we can do differently for one another, as she also dishes out words to the private organizations.
One of the things we can do differently is, number one, we don't discriminate against people. We show more understanding. We show more kindness. Also, we're a society where we have become so materialistic and unkind, particularly in the cities. You know, people don't even feel moved when they see people scavenging in the dustbin for food. It doesn't move them. They just think those are those people. Here we are all right. It's wrong. We're not okay when the person next to us is not okay. So it's important that we should be more caring. But government has a role. Government should provide for mental health care in every primary health care facility. Every Nigerian, whether they have money or not, they should be able to access mental health care. That's why we're advocating that mental health care should be included in the basic universal health care package. It shouldn't be something that people have to pay to come for. Imagine somebody is feeling suicidal Maybe because his business has failed, he doesn't have any money in his pocket. Then he says, you are saying it on TV. If you are not feeling like dying or you are feeling severely unhappy, please go to a hospital. But when the person goes to the hospital, the first thing says, can you register? You have to pay this, you have to pay that. A man that has no money, he will just say, thank you, I don't have anything. And he will just probably say, even to register for hospital, I don't have. What a useless life is this? He may go and commit suicide. I think the private sector has an important role to play. Government cannot do it all. Beginning first of all with employing people with mental health challenges. If you are working in a private company now and the person suffers depression, next thing they fire the person. They'll say, well, no, but whereas if that person was working for government, he probably would not get dismissed like that. So the private sector should do better integration. The private sector too should do better workplace mental health. A lot of people, their mental health challenges even begin from work. You just take somebody and I say, the company has a downturn, you just fire them. Maybe somebody you have put on a very good salary before, he just gets to work one day and the letter says he's dismissed, So private sector should have better workplace mental health. They don't have to overwork people. They don't have to say because they are paying people well, so those people, they must work 24 hours. They will close. Email will still be dropping into their system. They must respond urgently before tomorrow. It's like they're working 24 hours a day, 7 days a week. There's undue competition among the staff. People, so that can take place. The private sector should be able to have some corporate social responsibility that is mental health related. Even sponsor an event for young people. Let them just come and play football or basketball together. Let them just come and play Ludo and Scrabble together. It's not very expensive, but it takes these children away from things like drugs and so on.
Precious Aslam, one of the individuals present, gives his take on mental health.
My take home is that mental health conversations has been ongoing for a while now, but there's need for everybody to be included in it. The more the merrier, because mental health is not something that is isolated. It concerns everybody. When we say mental health, we're not just talking about mental health in terms of as a condition. It's a state of mind, and it concerns everybody, whether you are actively involved at the CSO level, or you're actively involved as a service provider, or you're just an individual. It involves everybody and is a universal human right.
Reporting from Nigeria's state capital, Soibifa, Jackridge, Top Accolade News.